Hello, everyone. My name is Gurja Basra, and I'm the Manager of Patient Programs, Research, and Advocacy here at Lymphoma Canada. I'm pleased to welcome you all to the final live session of the day titled Managing Symptoms and Side Effects for Lymphoma Patients. Just before we start, I want to go through a few housekeeping items. If you were in the previous sessions, you already know this information, but I'll just go over it in case someone is new. So this Zoom software does not allow you to access your camera or your microphone. So if you do have a question, please be sure to enter it in the chat box option at the bottom of your screen. Additionally, this webinar will be recorded and it will be available on our website afterwards, and you will also receive links to access these recordings in your email. With that said, to introduce our speaker today, we have here Charlene Downey, who is a nurse practitioner in the Division of Hematology at the Health Science Center and the Dr. H. Bliss Murphy Cancer Center in St. John's. She has been a registered nurse for 27 years and a nurse practitioner for 18 years. She considers herself to be a true hematology/oncology nurse at heart, having started her nursing career as an inpatient hematology/oncology nurse and never leaving that area. Throughout her nurse practitioner career, she has worked in both inpatient and outpatient settings. In her current practice, Charlene works with patients undergoing systemic chemotherapy with any hematological malignancies. Charlene is also a member of Lymphoma Canada's Nurse Advisory Board. So we are so happy to have you here today, Charlene, and you can get started as soon as you're ready.
Thanks so much for that lovely introduction. It's my pleasure to be here tonight, and thanks for sticking with us right till the end of the session tonight. So let's jump right in. First of all, these are my disclosures. As Gorjat said, that I'm on the advisory board for Lymphoma Canada, and I've also done some speaking engagements for Novartis and Janssen. So tonight we're just going to cover some of the symptoms that you may have presented with your diagnosis of lymphoma and what can be done to help manage them, as well as some of the common side effects that you may experience as you go through your treatment, as well as how can we manage those for you. So what are some of the common symptoms that you may have? Well, first of all, some of our patients can be really asymptomatic with their lymphoma. And when I'm talking about this, I'm mostly thinking about patients who have chronic lymphocytic lymphoma or leukemia, and that's more, in keeping with blood issues instead of nodal disease. So instead of having lumps or bumps, it's more of a numbers issue with your blood. Second of all, you think about having what we call lymphadenopathy. So these are the lumps and bumps that we talk about when we see you in clinic. You may have had some swelling in an area in a lymph node. You may have also had some what we call lymphedema. So what that is swelling of an arm or a leg. If that lymph node that you have that is abnormal and swelling is putting pressure on the normal area, such as up in your armpit, your affected arm may be swollen, or in the groin area, so down in the top of your leg, you may find that your leg itself is swollen if there's a lymph node and they're pushing on the normal drainage system for that limb. Other symptoms you may or may not experience are called constitutional, or what we call B symptoms. So what these are a constitution of symptoms or a bunch of symptoms that you may or may not experience. You could have all three. You may only have one or two. And these are fevers, which tend to have a bit of a pattern. So coming at the same time of the day or night on a consistent basis. You may also experience night sweats, and these are not the same as what you would have, you wake up, you're a little warm, you're a little clammy in bed. These are what we call drenching night sweats. So you have to get up in the middle of the night because you soak through your pajamas or your nightgown, and maybe even down to the sheets, and you're changing your bed through the night. And then third would be unexplained weight loss. So you haven't been trying to lose weight, but the weight's kind of falling off you. So that's what we talk about with constitutional or B symptoms. Some patients may also experience shortness of breath, and this is dealing with if you have some lymph nodes or lumps or bumps that are in your chest and affecting your lungs. From this, you may also have a cough. You may also experience fatigue, especially if your blood work is being affected. Depending on where your lymph nodes are swollen, you may experience some changes in your bowel habits, or you may become full easily. And what we call that in clinic is called early satiety. So you sit down to a meal, you think you're going to be able to finish it all, but you're full after a few bites. You just can't feel like you just can't eat anymore. And then again, depending on where the location is of any of these swollen lymph nodes, you may experience pain. So these are some of the symptoms you may have at presentation when you come and have your diagnosis of a lymphoma. So once you have your diagnosis and you're started on your treatment plan, what does that look like for you? What side effects may you experience? And again, not everybody is going to experience the same side effects. We talk about averages when we talk about, treatment options and how successful they may be. That's the same way when we talk to our patients about your treatment side effects that you may or may not experience. I always tell patients that it's better to prepare for what you could experience and hope for the best that you get nothing. So I tell everybody I give you good armor, I put you out with a good safety net so you know what to expect. One of the major side effects that can happen is nausea and vomiting. Of course, most of our chemotherapy regimes, if they are nauseating or can cause you to have nausea and vomiting, so a sick stomach, we tend to give you medications to offset that. These are called anti-anemics in our clinic, if someone refers to them that way, but it's anti-nausea medications that you can take. Sometimes they are prescribed to take on a routine basis, so you may have to take them twice or 3 times a day on the day of and day after and so forth of your chemotherapy. And then you may have a prescription that is what I call a rescue. So if you're having nausea or vomiting in between that you can take that to help alleviate it. There's some patients who'd like to know what else they can do other than medications to help offset this side effect. One good way to deal with this is to have small, frequent meals. So what I tell my patients often is to be like a cow and graze. Go and take, instead of sitting down to 3 larger meals, a normal size that you would eat prior to having started your chemo, let's cut that back. Let's eat every couple of hours. Try not to let your belly get empty. And that sometimes helps. Other side effects that affect the GI tract would be of the bowels, and this can be either diarrhea or constipation. It depends on the medications you're on, and it depends on you yourself and how your body reacts. Ways to deal with this are to increase your fluid intake if you're able. Of course, it's really important to stay hydrated while you're on your chemotherapy. So if you're having diarrhea, especially, it's important to try to keep up on that because you will lose some of your fluids out through your diarrhea. Exercise helps, and this is especially important with constipation. So being able to mobilize, move around, even if it's just walking around your living room, this will help kind of keep things moving through that GI tract. There's various foods that you can eat to help with the diarrhea, the constipation, and as well as your nausea and vomiting. So a good resource here can be your nutritionist or your dietitian. And of course, there are medications that we can use as well to help offset some of these side effects. When it comes to diarrhea, we'd like for you to touch base with your clinical team before you take anything like Imodium that you can purchase over the shelf to help control that diarrhea if you need it. And the reason we ask you to touch base with your healthcare team is on the off chance there could be an infection in your bowel, you wouldn't want to slow that down. So just touch in with your pharmacist or your nurse. Another side effect that affects the GI tract would be mucositis. So this is a fancy name to say basically you have a sore mouth. There's varying degrees of the sore mouth or the mucositis that you can get. Something as simple as just a little bit tender, when you eat, it kind of tingles a little bit, especially if it's something spicy or salty. Ways to offset this is to use your either normal saline, so your saltwater rinses, or baking soda mouth rinses. How often do you need to do these? I recommend that you do them whenever you think about it, basically, but especially after you've eaten them before you go to bed, just to make sure there's no food debris left in your mouth to give you an area to get sore. And of course, if it starts to get a little tender in there, that could get worse as time goes on, and you could even get a mouth ulcer, which may affect your ability to eat. So try to stay on top of that. Other mouth rinses have been recommended as well, but it's really important to try to get something, if you're the type of person who likes to use mouthwashes, to use something that doesn't have alcohol in it, because alcohol can be drying. There's lots of products on the shelf now that you can purchase. It doesn't have to be anything fancy, but you can get your general Listerine scopes, these sort of things without alcohol. Soft toothbrushes are really important so that you're not irritating your gums if they are tender. We usually try to avoid flossing your teeth in the middle of chemotherapy, because that can cause, if the gums are tender, that can cause bleeding and irritation. So try to avoid that if we can. And then if your mouth is a little bit more sore, or you're having a lot of trouble trying to eat and stay comfortable, there are medicated mouth rinses that can be used, and you need to have those prescribed, and they get mixed by your community pharmacy for the most part. They tend to be very helpful, because most of them will have something in there like a topical anesthetic, so something to help freeze up the mouth. If you think about if you've had children or a sore gum yourself, you might go to the drugstore to pick up a little Oragel, similar to that it's there, that it can help things feel better. And then the other one that I find is affecting people, and it affects kind of your ability to eat and enjoy food, is taste changes that come along with your chemotherapy. And unfortunately, there's not a whole lot that we can do to avoid that. Patients will tell me that things taste a bit metallic, nothing tastes like it should. But trying to kind of push past that as much as you can to be able to maintain your nutrition. Some of the ways that I found helpful for some of my patients is, again, the small frequent meals, so that you're not facing a big portion of something that doesn't quite taste right to you. Trying to eat foods that are at room temperature instead of extremes of really hot soup or really cold ice cream. And even though I'm telling you that maybe food temperatures are important, ice sometimes will help with the taste changes that you may or may not have, because it kind of numbs the taste buds and you don't taste things as well. So if things don't quite taste right, sucking on an ice cube or a popsicle or something before you eat a meal may help you enjoy it a little bit more. Moving on to the lungs now, what may be some of the side effects that you have with your chemotherapy with this? One of the big ones that we watch for, especially in Hodgkin's lymphoma, is the development of a cough or shortness of breath. And that's because one of the chemotherapy drugs in particular that we use with Hodgkin's, this is the drug called bleomycin, can run the side effect or risk of having some lung toxicity, so damage to the lungs from the drug itself. So we watch that with every cycle of chemotherapy to make sure that you're not developing that. Shortness of breath you may also experience. It may be fine when you're sitting down, but you might find yourself a little bit more winded as you're walking around while you're, walking into the hospital to get to your appointments and whatnot. That's important for us to know about too. It could be a side effect of the chemotherapy from the drug itself, but it could also be a side effect that is affecting your hemoglobin. Your hemoglobin carries your oxygen around your blood. So if that's low, you may be a little short-winded as well. So that's really important for us to know about. In order to try to manage that yourself, if you are finding that you're short of breath, the best thing you can do is listen to your body and do things at a slower pace as you're able. But of course, always bring it to the attention of your clinical team. There can be side effects with your heart as well. One drug in particular that's used for the most part for CLL, these are the drug class called tyrosine kinase inhibitors, or TKIs, and I have a couple of the examples listed here. These are the imatinib, dasatinib, nilotinib, bosutinib. They come along with some risks to your heart. You can develop high blood pressure. And this is something that should be monitored in your pre-chemotherapy check. You can also enlist the assistance of your primary care provider to help monitor your blood pressure. You could also develop something called atrial fibrillation. So what this is when your heart normally pumps on a nice rhythm, nice and rhythmic, nice and normal, kind of at a normal pace. Atrial fibrillation is kind of when your heart goes a little crazy and it kind of pumps and pumps at a little bit of a funny rate and there's not much rhythm to it. That's something we need to know about, and it's something that needs to get treated as well. So you probably end up on some medication for that. And going along with this, you could also develop some cardiac chest pain. So that's called angina, so some tightness in your chest. So those are important things to know about. Other side effects that you might encounter are abnormalities with your blood counts. Our chemotherapy run the risks, of course, of while they're doing their job to kill off all those cancer cells that we're trying to get rid of, chemotherapy are not that smart that they can only see the cancer drugs, unfortunately, and can affect your blood counts themselves. So what can happen is your neutrophils, which are your baby white blood cells. They're really important to fight infection. And if they go down low, and by low, I tend to mean less than 1.0, then you're at an increased risk for infection. So that's when you need to be extra cautious around patients or, other people who may be feeling unwell. You wouldn't want to put yourself at risk of picking up an infection from somebody else. You may also experience low platelets, and what platelets do is to help you stop bleeding if you were to cut yourself. So if your platelets are low, you may be at an increased risk of bleeding, or notice that when you're, brushing your teeth, you may bleed a little bit easier, or if you're shaving, you might nick yourself and see a little bit of bleeding. So that's one of the things that you need to watch out for. Depending on how low your platelets go, you may or may not need to have a platelet transfusion to help decrease your risk of bleeding while your counts are low. And then the other thing that you may experience is a low hemoglobin, and this is called anemia. And as I just said in the previous slide, your shortness of breath may be caused by this as well. So when your hemoglobin is low, you don't have as much capacity to bring oxygen around your body, and that will make you feel short of breath. It may also cause you some heart symptoms like palpitations, feeling like your heart's kind of pounding a little bit, or even some tightness in your chest, and that would be from the low hemoglobin. And again, if that's the case, you may need a blood transfusion to help bring that up so that you're not feeling those side effects. You may experience some hair, nail, and skin changes as you're on chemotherapy as well. Some chemotherapy protocols, you may lose all of your hair. It doesn't happen all at once. It tends to be, a week or two, could be even a little bit longer after your first cycle of chemotherapy. And you'll start to notice that your hair is starting to get thin and you're losing parts of it. Some chemotherapy agents, your hair will just thin and you won't lose it all. So it's important to kind of keep an eye on that for yourself. Things to help with that, of course, are gentle cleansers, especially as your hair is falling out. You may find that the hair follicles are tender and your your head gets a little tender. And often patients will tell me that in bed at night, the hair tends to pull a little bit. So cleaning your hair and your scalp gently will help a little bit with that. Trimming your hair down if you are having longer hair, sometimes it's easier, doesn't hurt as much from a pulling perspective if your hair is a little bit shorter. And from a psychological perspective as well, it may be a little bit easier to just go gradually a little bit shorter as your hair is falling out. Of course, scalp massages may be of benefit as well, just to kind of alleviate some of the discomfort you may feel. And then some patients will choose to wear hats and scarves and wigs if their hair is thinning or when they've lost their hair, for a couple of reasons. One is to keep themselves warm. You lose a lot of heat from your head. And when you have no hair, that increases, so that helps a lot. and as well just for aesthetic reasons too, so to help your, feel a little bit better, cover your head, keep yourself warm. Brittle nails tends to be another side effect of our chemotherapy. A lot of patients will find that their nails may peel or crack easily, so it's important to try to keep them trimmed. Do some gentle nail filing if you get a hitch or a tear in your nail. And some patients will even use a little bit of clear nail polish to try to protect them and keep your nails from hitching and hooking in things. From the skin perspective, chemotherapy can be quite drying on your skin, so I usually will recommend to do tepid type baths and showers. So warm water versus really hot water, because that hot water can draw the moisture out of your skin. When you're finished bathing, instead of, rubbing yourself dry with your towel, patting yourself dry is another way to try to keep some of the natural oils on your skin and let the water kind of soak in. And of course, moisturizing is important. So, all that over body moisturizer would be of help. I like the oatmeal containing ones. They're really gentle on the skin. It doesn't have to be a brand name. You could buy something that's a store brand, and that would be perfectly fine. And along the same lines, when you're talking about moisturizing, where you're washing your hands so often to try to keep yourself healthy through your chemotherapy, your hands will tend to get fairly dry. So having a good hand moisturizer will be important for you as well. So you can have some side effects that affect your brain, of course, and I'm sure everybody who has been on chemotherapy or even heard about chemotherapy has heard the terms brain fog, chemo fog, brain fog, brain issues, confusion, just not quite up to par. This is a real phenomena that our patients will go through on chemotherapy. It tends to last throughout the duration of your chemotherapy. Some patients have it last a little bit longer as well. It's not like, your chemo is finished today and tomorrow all that fog clears out. It can take a little bit of time. So what patients will explain and to tell me about is that they're just not quite as attentive. Their attention span is not there. They try to read, were avid readers before, and trying to read a book, they may have to read the same page 1 or 2, 3 times before they kind of get what was on that page for them. Sometimes that can be quite frustrating, and trying to find ways around the chemo brain or the chemo fog is important. Oftentimes, making lists can help, setting reminders. Our smartphones are wonderful inventions now. I don't have chemo fog myself, but I use my phone to remind myself to do things all the time and make lists. Great little reminders. And I wrote down patience. So patience, not only for our loved ones to have patience with the patient going through the chemotherapy, but to have patience with yourself. You're going through a tough time, and you have reasons for, this inattentiveness or forgetfulness, and trying to just have that small bit of patience with yourself to catch yourself a little bit of growth, get a little bit of slack. Some patients may also experience headaches when they're on their chemotherapy, and that's important to note as well. A headache can be, quite uncomfortable. And for the majority of the time, most of us would reach for an Advil or a Tylenol, also called ibuprofen or acetaminophen, to treat a headache. But on chemotherapy, we really don't want you to do that. We'd rather you reach for something that's prescription that we've okayed, something like codeine, because what Tylenol or acetaminophen and Advil or ibuprofen does is it can mask a fever. So if you were to have a fever, Tylenol or Advil will bring that down. And we kind of are really, really stressed about fevers. They're really important to us in our world when you're on chemotherapy, because that can sometimes be our #1 sign that you have an infection. So we don't want you to mask that or cover that up by taking Tylenol. So if you do tend to get headaches, make sure you check with your clinical team or your pharmacist to see what's your best option and if you need a prescription for something. There's some new therapies on the go now that come up with some unique side effects. I'm not going to spend too much time on this because they could be a whole talk in themselves. But the two new therapies that I'm thinking about are the CAR T therapy, which is chimeric antigen receptor T cells, and the BiTE therapy, so the bispecific T cell engagers. So these are cellular therapies that we're talking about here. And they carry a risk of two different syndromes that you can develop when you first start these. One is called CRS, and that's cytokine release syndrome. And what this is basically a big response of your immune system to these cells coming in your body. And that can have various grades. It can look like, just a temperature, some fluctuations in your blood pressure or your heart rate. But it can be serious enough that it may need treatment. It may even need you to go to an increased level of care, such as a step-down unit or to an ICU. Not to scare anybody, but it's a possibility with these new therapies. However, where we know how to treat them and we know, time is of the essence when we're talking about these. So closeness, being close to a hospital or even being an admitted patient while you're going through these therapies are important in the early stages. Another side effect with these new therapies is called ICANS, and that's immune effector cells basically having the same response in the brain. So it's neurological side effects. So, we talked about chemo brain and chemo fog earlier. This is a little bit similar, but a little bit more intense than that. So trouble with your words, trouble with your writing, trouble remembering things. And again, this can go from mild to severe, but it is something that needs to be monitored for 48 hours for the most part after your first initial couple of doses of these BiTE therapies or after your CAR T. So something to be aware of. Again, won't go into too much detail about that tonight. And then there are other side effects. There are many other systems in our body that can be affected by our chemotherapy. One of the major ones that I like to highlight for our patients is whether or not you are a diabetic or are predisposed to diabetes or at risk for, your blood sugars can increase and you could develop higher blood sugar or even diabetes when you're on some of our treatments. And that's because a lot of our treatments contain steroids, and steroids can increase your blood sugars. So that's something that we watch for as you go through our chemotherapy, and that'll get monitored with your usual blood work. If you are a diabetic, we'll be asking you to watch your blood sugars at home and to let us know if you're having any trouble with high levels so that we can get that under control for you. I think that highlights the majority of the side effects that we see. There are others that I would have liked to touch on, but you're going to have some sessions tomorrow that are going to highlight these in greater detail. So tomorrow is about a wellness day. So it's going to be focusing on nutrition because that's really important as you go through your chemotherapy. And of course, your chemotherapy can affect the way that you eat, how you eat, what nutrition you get. Fatigue is also a big one that you can experience as you go through your chemotherapy. Again, that will be discussed tomorrow. And insomnia, and this can be, from stress, it can be from the medications we're using. You just may have an altered sleep-wake cycle. So again, that'll be discussed tomorrow. And that's the end of my presentation for now, and I'd be happy to take any questions if there are any.
Thank you, Charlene, for that overview in regards to side effects management. Just a reminder to the audience, if you do have any questions, please be sure to enter it into the chat. So we do have a few questions already.
Great.
So we'll start off with the first question. 6 weeks post-IV of bendamustine plus rituximab. I still have pain in the vein that was accessed, seems bruised. What could be the cause? Example, vein hardening. And what can be done to lower the likelihood of issues with future IV treatments?
That's a great question, and that's something that can tend to happen often with the IV treatment, especially if it's being used with a peripheral, as we call it, vein, so a traditional IV. The chemotherapy agents can irritate the veins themselves. So oftentimes I'll suggest using ice to try to apply the ice to the area just to decrease the inflammation that may be there. Voltaren is another anti-inflammatory that's topical that sometimes I'll recommend that we use. And if this is not helpful, bringing it to the attention of your clinician just to ensure that there's no what we call phlebitis, so an inflammation of that vein itself from the chemotherapy. Sometimes that may need a low dose aspirin or something to try to help that inflammation improve. So bringing it forward to your clinician will be really important. Thanks for your question.
Thank you, Charlene. Next, we have a question. This patient has non-Hodgkin's follicular lymphoma, stage 4. They were treated in 2012 and again in 2019. Is ringing in the ears a side effect from chemo? They got their hearing tested and they were told that they have minimal hearing loss. So any comments in regards to that?
It really depends on which chemotherapy agents were used at the time. I imagine back in 2012, there could be one of the medications used at that time may have been vincristine, and that could cause some of the ringing in the ear. A good ear, nose, and throat assessment by an ENT person would be a good idea as well, but bringing it forward with the family physician.
Thank you, Charlene. And another patient with follicular lymphoma. What are possible treatments for neuropathy which developed after 3 cycles of R-CHOP?
Good question. That's one that can tend to come up often. So again, you need to speak with your clinician about your neuropathy symptoms. How bad is it? Is it affecting your functional ability? Is it affecting your quality of life? Sometimes a tweak, as I call it, a little decrease in the dosage of the affecting medication, so that's usually the vincristine as well, may be necessary to help alleviate some of that symptom for you. There are other medications that we can use if it's painful or bothersome in that way. It depends on how bad it is, really. And there are oral medications, and I've had some success with topical medications as well. So again, bring it forward to your clinician and have a discussion about it. It'd be great.
And the next patient has CLL instead of follicular lymphoma. And ever since receiving treatment, they've noticed that their psoriasis has begun to flare up. So do you have any advice in terms of how this patient can manage this?
It would really depend on what you're being treated with at this time for your CLL, if it's kind of coinciding with it. Definitely bring it up with your hematologist or your clinician, whoever is covering you for your chemotherapy, seeing you for that. You may want to go back as well to your dermatologist.
Thank you, Charlene. And the last question for the day is, well, now we have 2 questions. How can you help with the fear of recurrence? Like what advice do you have in terms of dealing with the emotions associated with recurrence?
That's a really good question. Um, there's lots of supports out there to help patients after they finish their treatment to kind of move past and beyond their treatment and their cancer diagnosis. Um, One of the things I find is really important is talking with others about it, joining support groups would be quite helpful. And educating yourself, it's hard. I know it's really hard to try to say, you got to try to put it in the background and move forward each day. As you get further away from your cancer diagnosis, the majority of patients tell me that they are able to let it kind of slide into the background and not let it take on as much of their time as what it has before. But it would be important to reach out to someone too, I think, to talk it through with. I
Thank
know
you.
in Newfoundland we have a group starting, I think it's next week, called Transitions, and that's exactly what the group is about, trying to move past it and trying to, how do you deal with that fear of recurrence?
Yeah, and on the topic of this, Lymphoma Canada has also hosted a webinar previously on how to deal with the fear of recurrence. So I encourage you to visit our website so that you can view that. And
Fantastic.
perfect. And the last question for the day is, what are your views on combining traditional and alternate holistic medical treatments?
So I think it's important to explore whatever options you have, and that you would have to have a very open and honest conversation with your hematologist and whoever is making your treatment plan with you, so that you can make a decision together. Is it something that you can do one or the other, or if it's, a modality in a holistic point of view, that if it's something you want to do along with our traditional medicines, then you do that together, and that eyes wide open kind of thing, that your naturopath knows what we're doing, we know what they're doing and what you're doing, so that we can, manage any side effects that may be there, or you're at risk for, so that we be able to get you the best outcome.
Thank you, Charlene. I would now like to direct the audience to attend the closing remarks, and I hope to see you tomorrow when we focus on topics related to health and wellness. Thank you again, everyone, for submitting questions. There was lots of engagement today. Thank you and have a great night.
Have a great night, everyone. Thank you so much.